Ever wondered about the intricacies of the deep extubation process? It's a complex procedure that demands precision and expert knowledge. Today, we delve into the fascinating world of deep extubation, breaking down the process step by step, discussing indications, contraindications, and the technique itself. Deep extubation refers to the removal of an endotracheal tube while a patient is still under the influence of anesthesia. It's a technique that's particularly useful in specific cases such as pediatric anesthesia or when managing the airway is challenging. First, it's important to understand the indications for deep extubation. It's often used when there's a need to avoid coughing or bucking on the endotracheal tube, which can lead to potential complications like bleeding, increased intracranial or intraocular pressure. It's also beneficial for patients with a difficult airway or for children to reduce the risk of laryngospasm. However, deep extubation is not suitable for everyone. Contraindications include patients with a full stomach, obesity, pregnancy, or those with sleep apnea. Other factors to consider are the patient's pre-existing lung conditions or if they have a history of aspiration. Now, to the technique itself. Deep extubation requires careful monitoring and preparation. Start by ensuring the patient is in a deep plane of anesthesia. This is crucial to prevent any reflexes that might cause complications. Then, the anesthesiologist must verify that the patient has adequate oxygenation and ventilation. Next, the anesthesiologist removes the endotracheal tube gently, taking care not to stimulate the vocal cords. Remember, the goal is to maintain a deep level of anesthesia to avoid any coughing or bucking. Once the tube is out, the anesthesiologist must closely monitor the patient's recovery from anesthesia. This includes checking vital signs, ensuring adequate oxygenation, and watching for any signs of airway obstruction or aspiration. In conclusion, deep extubation is a delicate procedure that requires expert knowledge and precision. It's indicated in specific cases like pediatric anesthesia or challenging airway management, and contraindicated in conditions such as obesity, pregnancy, or a full stomach. The technique involves maintaining a deep plane of anesthesia, careful removal of the endotracheal tube, and close monitoring of the patient's recovery. This journey into the world of deep extubation shines a light on the meticulous process anesthesiologists undertake to ensure patient safety and comfort. It's a testament to the complexity and critical nature of their role in healthcare.